It's time to address the healthcare affordability challenge head on. As healthcare costs rise in Kentucky, people are faced with tough decisions, and family might be delaying or skipping care because of cost concerns. Beth Kaiser, West Region President for Anthem Blue Cross and Blue Shield, joins me with more. Thanks for joining us today.
Thank you, Al.
So what are some of the biggest factors driving up healthcare costs right here in Kentucky?
Yeah, there's many complex factors around that, including rates of smoking, obesity, and physical inactivity that are significantly worse than the national average. But in addition to an aging population, those chronic conditions I mentioned, and escalating drug prices, we're also seeing increased costs from provider consolidations, fraud and abuse, as well as ongoing legislative changes.
Yeah, we are seeing a lot of consolidation in the healthcare insurance marketplace. So what effect does that have on the cost to the consumer?
Yeah, oftentimes when those consolidations happen, providers have less choice and increased cost strategies to make sure we keep affordability for our members. And the way we do that is through creating things like looking for fraud, waste, as well as looking at benefits and contracts that allow for more choice and of high quality providers for our members. And then specifically on the waste and abuse piece, we're using AI data to help us better understand unusual charges, such as phantom billing, where a member is charged for a service that wasn't provided, or double billing, where they're charged twice, or upcoding, where they're charged for a service at a higher level than what was provided.
You did kind of hit on this a little bit, but what is Anthem Blue Cross and Blue Shield doing to help bring those costs down?
Yeah, we've got to work with all of the stakeholders, with our healthcare provider partners, with legislators, et cetera. But specifically what Anthem Blue Cross Blue Shield is doing inside Kentucky is we're helping to make sure our aging population has help and assistance with navigating complex healthcare so that we can avoid unnecessary stays in the hospital. We're also looking at AI to increase the fraudulent billing exercise that I talked about. We're reducing escalated pharmacy prescription costs. We're doing things like providing disease management programs for individuals who have chronic conditions. Those are the types of things that we're doing at Anthem Blue Cross Blue Shield to support the affordability crisis.
And of course, this is also at the state and the federal level as well. So what legislation would you support to help bring down those costs?
Yeah, Elle, when I think about legislation, the No Surprises Act that was actually passed to help protect affordability, unfortunately, it's had some unintended consequences and actually increased cost in some cases. And so to combat that, we're working in 2026 with our provider partners to implement new policies around allowing out-of-network physicians, specialists, to actually bill through an in-network facility. And so when you say, well, what will that do? That will help encourage those specialists to join our networks, which will lower costs for our members.
And of course, this is a major concern for our viewers. So how can people learn more?
Yeah, I would encourage you. I mean, it's got to be our top priority. Affordability does, because, you know, if we have unaffordable health care, we'll have inaccessible health care. So it's important for Kentuckians to take notice, and we would encourage you to look at our website. It is www.anthem.com/affordability in Kentucky. And thank you so much for allowing me to join you.
Absolutely, Beth. As always, thank you.
Thank you, Elle.